All right, so we're going to start into pathophysiology, and the first chapter in our text is an introduction to pathophysiology, and it's a relatively short chapter, but it's packed with information. And so I have 3 hopefully short little chunks of lectures to help go through this information. So, okay, I'm just waiting for my PowerPoint to advance. There we go. Homeostasis is the maintenance of a relatively stable internal environment regardless of external changes. So when homeostasis is maintained, good health is generally maintained. When homeostasis is not maintained, disease may develop. So we can think of, under normal conditions, homeostasis is maintained with just frequent minor changes. It's that little balancing act. Something happens, the body responds to it, and it's easily maintained. When there is a significant change that occurs, it can lead to a state in which you cannot maintain homeostasis without intervention, whether it's medical intervention or some other type of intervention. So that's when we start getting into the pathological end of it. So just as basic definitions, health is physical, mental, and social well-being, and disease is deviation from the normal state of homeostasis. So this doctor is applying an intervention to maintain this guy's homeostasis. I don't think it's an intervention that really exists, but kind of funny. So in PT, of course, we're largely concerned with the physical health of people, but the mental and social part come in as well. So health indicators are normal, in quotation marks, values that occur within a range of values and might vary depending on how you measure it. For example, you're taking somebody's temperature, oral temperature versus a rectal temperature versus an axillary temperature, it's going to be different. And then, so the technology that you use for measurement can cause it to vary. Also, things like age, gender, genetics, environment, and activity level. You might have someone who has a very, very fit, very high activity level that has a super low heart rate just because they're super fit and their heart is really efficient. You might have someone that has a really low heart rate because of a pathological process going on. So being outside the normal ranges doesn't necessarily mean there's pathology going on, but it can be an indicator. So when doctors are looking at all of these health indicators, they're not taking one in isolation. They're looking at all of the factors and seeing if they can see a general trend towards a disease process or not. So in the book, they have these 7 steps to health, and I think they're really nice to think about. As physical therapist assistants, I think we are in a good position to be advocates for good health and to help people develop and maintain a healthy lifestyle. So I think it's really important for us as well to maintain that healthy lifestyle, because if you're not healthy, you can't do your work and you can't go out there and help people. So it's important. Being a non-smoker and avoiding secondhand smoke, that's a good step. Good diet and limiting alcohol intake. Physical activity on a regular basis, super important. That's something we can really advocate and instruct our patients in. Protection from the sun, especially if you're out there being active in a nice summer like this, and maybe you're on the water. You have to take some extra measures to protect yourself from the sun. You want to follow cancer screening guidelines. You want to have regular doctor and dentist visits, because if you have regular visits that they can detect changes in the normal state of your health, it's a lot easier instead of waiting till something drastic happens. Following health and safety guidelines at home, at work, and when using and storing and disposing of hazardous materials. So in 110 this summer, you're going to be learning transfers and things about infection control and personal protective equipment. Those are all really important for health and safety guidelines in the workplace. So For the concept and scope of pathophysiology, the functional and physiological changes in the body that occur as a result of disease, that is really what pathophysiology is all about. It uses our basic knowledge of anatomy and physiology, and it includes aspects of pathology, so describing structures structural changes in body tissues caused by disease. Hopefully in anatomy and physiology you got to look at histological slides of normal tissues, so you can say, okay, this is what normal muscle tissue looks like. Well, what does diseased muscle tissue look like, or damaged muscle tissue? And in pathophysiology, we're often establishing a cause and effect relationship defined by signs and symptoms as a guide to the study of a specific disease. So in almost every disease, we're going to be talking about the pathology and the etiology and the signs and symptoms, and characterizing these different diseases. So prevention, in the book it says it has become a primary focus in healthcare. I think we have a ways to go on that with our current healthcare system, but let's make it a primary focus. So these are some of the focus for prevention: maintaining routine vaccination programs. I work in a hospital-based clinic, and we're required to get a flu shot. If you don't get a flu shot for whatever reason, people have perfectly legit reasons for not getting flu shot. But if you choose not to get one, you have to sign a release saying you didn't get one, and you have to wear a mask every day during the officially declared flu season. So for us as healthcare professionals, it's really important not just to keep us from getting sick, but to protect our patients. So being a relatively young and healthy person, I will probably not get the flu, but I don't think it's fair of me to risk my patient's health either by not getting a vaccine. Participating in screening programs, community health programs are important. I do in my spare time some advocating for Parkinson's in the community. I do a quarterly class on better living with arthritis, teaching people about exercise with arthritis, and the community health programs can be really helpful for prevention of disease and prevention of deterioration if you already have disease. And regular routine doctor visits are also important for prevention. In the text in box 1.2 on page 3, they talk about primary, secondary, and tertiary prevention. So primary prevention the goal is to protect healthy people from developing a disease or experiencing an injury in the first place. So nutrition education and safety education and regular exams and screening and immunizations, those are all primary prevention. Secondary prevention, these interventions happen after an illness or risk factors have already been diagnosed, and the goal is to halt or slow the progress of the disease at its earliest stages, or limit the effects of injury. So the community health programs that I participate in, the Better Living with Arthritis and the Parkinson's programs, that is secondary prevention. People already have arthritis or they already have Parkinson's, and I'm helping to tell them how can they slow the progress of the disease, how can they maintain their functional level at the highest level that they can. Tertiary prevention focuses on helping people manage complicated long-term health problems such as diabetes, heart disease, cancer, chronic pain, lots of things, cardiac or stroke rehabilitation programs, chronic pain management programs, and patient support groups. And frequently in physical therapy, we are involved in this tertiary prevention phase. So, okay, the person's already had the stroke. How can they get the most function out of their body? How can they make it so they're not going to get worse? And that's a major focus of physical therapy. So there's a section in the book about research, and research is really important in terms of we want to make sure that the interventions we are providing are evidence-based. There is evidence to support that the interventions we're providing are effective. So for a long time, there are interventions being provided that really didn't have any evidence to support them. Maybe clinical observation, that was the level of evidence. And we're going to talk about the different levels of evidence in research. But the stages of the research process are usually the basic science. So, your basic chemistry, biology, physics, all of our basic sciences are going to go into the research process. Identification of technology, work done in the laboratory. There might be animal or cell tissue cultures that processes are tested on. In stage 2, they're moving to a small number of human subjects. So a lot of times when we talk about pharmaceutical research, we're working with that, a small number of human subjects. In stage 3, they're doing clinical trials. They involve large number of patients with the disease or at risk of the disease. A lot of times these are double-blind studies. And a double-blind study means that neither the researcher nor the people involved in the trial know who's getting what treatment. So it's an attempt to take bias out of the observations. So this is from the PTA board exams study materials, and I have 2 different versions of it. So this is right out of the study materials, and it talks about the levels of evidence. It's a pyramid structure for studies about, specifically this one, about physical therapy interventions. So sort of the lowest level of evidence is ideas and opinions. The next level is case reports, and we'll talk about what each of these are. Case series, cross-sectional studies, case control studies, cohort studies, randomized controlled trials, and then at the top, systematic reviews and meta-analyses. There is another version of these that I got from one of my friends who's a college professor, and she specializes in philosophy and logic. And so she often has these really cool infographics that she shares with me. And this one has a little more of a, it says what is scientific evidence and what is not. And I sort of get the idea this is from thelogicofscience.com, which is a logic website. And I sort of get the idea that the person who wrote this has some issues with some particular websites in the not scientific evidence range. But this is the same pyramid that we just had. It's worded a little bit differently. So at the bottom, case reports, opinion papers, and letters being the weakest scientific evidence. Animal trials and in vitro studies, cross-sectional studies, case control studies, cohort studies, RCTs, randomized control trials, and meta-analyses and systematic reviews. So a systematic review is a comprehensive review of the medical literature that uses explicit methods to systematically search, identify, appraise, and summarize all the literature on a specific issue. So systematic reviews are often used to sort of say, okay, what research has been done and what does it show? So that's considered the top tier of level of evidence. If there's a systematic review that shows that something is valid and appropriate, that's pretty good evidence that it's the right thing to do. A meta-analysis is a systematic review using a statistical technique that derives an estimate of effect size by combining the results of several randomized controlled trials to determine the overall effectiveness of the treatment. The advantage of meta-analyses is they minimize the problem of small sample size from individual studies because they pool the trials and it increases the overall sample size. So a meta-analysis is also considered highly valid. So a randomized control trial is sort of the holy grail of research, and it's what a lot of researchers can do, as a group. It's a form of experimental research that is used to assess the relative effect of a specific intervention compared to a control condition. So the randomized part is patients are randomized into a control group and at least one experimental group. And sometimes more than one. So it can be like people are getting 3 different treatments, or the test treatment, the standard treatment, and then no treatment, something like that. The control group gets either no treatment or a standard default treatment. They're the comparison. Ideally, the groups are identical except for the intervention that they're randomized to receive. But of course, we're human beings. We're not going to be identical. So an example of a randomized controlled trial, there was a study done in 2008 where the researchers took people with Parkinson's, and they had specific criteria that the people had to meet to be in the study. One group, the control group, received traditional physical therapy treatment, and this was published in the Journal of Neurological PT, and I can give you a copy of it if you would like. But the control group received regular balance training, and the idea was to test different balance interventions in people with Parkinson's and see which were more effective. And the test, the before and after test, basically, was the Berg Balance Scale, which is a research-proven tool that we use pretty frequently. And so the control group got traditional balance training. The test group was taught tango dancing. So they did regular tango dancing at the same frequency as the balance training for the control group. And then there was another group that did just basic physical exercise. So they had the list of what the exercises were. And then at the beginning, at the end, they tested them out on the Berg Balance Scale. Well, the test group who were doing the tango performed significantly better on the Berg Balance test. So that study showed that was a good intervention or an improved intervention for balance training with Parkinson's. So a randomized control trial, a lot of times when I have you do research studies for class, I want you to find either randomized control trials, meta-analyses, or systematic reviews. There are other things that you might find out there that are lower levels of evidence, and we want to have something in this top tier to show that our intervention is effective. So sort of the lower tier of the level of evidence, they're in the bottom part of our pyramid. A cohort study, it's a type of longitudinal observational study in which individuals with a risk factor or exposure are followed over time to compare the occurrence of a disease in the exposed group to the group of unexposed individuals. And exposed just might be that they have a factor that predisposes them to the disease. The measure of association between exposure and disease in cohort studies is the relative risk, meaning the ratio of the incidence rate of exposed individuals to that of the controls. So it just tells you if you have this factor or exposure, whether or not you're more of a risk for developing the disease than unexposed individuals. So the cohort study, sort of the classic one that went on for years, was the Framingham Heart Study, where Framingham, Massachusetts, like a large number of people in the town, were studied over the course of 30 years to compare their risk of heart disease. So pretty interesting cohort study. The case control study is sort of a retrospective observational study where they study people who already have a particular disease, and they're compared to a group of individuals without the disease. So the history of exposure or other characteristics prior to the onset of the disease is recorded through interviews and other sources and compared between the two groups. So the control group provides an estimate of the frequency and amount of exposure in people without the disease. So there's a lot of inference that goes on with case control studies. You can't exactly point to a cause and effect relationship, but you can get some valid data out of it. A cross-sectional study is a study where the data or observations are made at just one point in time, and all of the subjects are tested at relatively the same time. So that's the difference between the cross-sectional study and the cohort and case control studies, is the cohort and case control are over time, and the cross-sectional study is just one time. It's just like a static picture. It usually, in a cross-sectional study, they're trying to describe relationships between a disease condition or factors of disease that exist in a specific population at a given time. So it's more trying to characterize the disease than trying to establish cause and effect. And sort of the lowest level is a case report or case series. So an individual case report is an in-depth description of an individual's condition or response to a treatment. A case series is a collection of similar cases. With case reports or case series, you can't really test a hypothesis or establish cause and effect relationships, but it can be educational for what happens and signs and symptoms and what you see in particular people. So we will talk this summer. You'll talk with Lisa and Claudia about reliability and validity for goniometry. So a lot of times when we're using different measurements, we're trying to assess if we want to do things, of course, that are reliable and valid. And reliability is the reproducibility or repeatability of measurements. So I measure somebody's knee range of motion one day, and then I measure it the next day, and is it repeatable? Can I produce repeatable results? Is it reliable? Validity is the degree to which the measurement reflects reality, basically. So it's the degree to which useful or meaningful interpretation can be inferred from a measurement. So if I measure someone's knee range of motion, is that valid? Does it? Am I really getting an accurate picture of what's going on with that person? So a lot of times the reliability and validity of a test is assessed before it comes into common use. And you want to ask yourself, too, if you're doing some kind of measurement or test, is it reliable and valid? Can I reproduce this? Is it an accurate depiction of what's really going on with that person? So often, when people come in for their initial evaluation and when they go into a doctor's office, they are starting the process with a medical history. So in the medical, and it can kind of tell us a lot. The medical history is your current and prior illnesses, allergies, hospitalizations, treatments, specific difficulties, any type of therapy or drugs that the patient is currently on, prescription or non-prescription, or food or herbal supplements can be relevant. So this is just sort of getting a basic picture of what's going on with that person at the time they seek medical treatment. There are lots of new developments and trends in medicine. It's a pretty quick moving field in some respects. There's constant updating of information and knowledge. So when you work in the healthcare professions, you can't just learn what you learned in school and then go on with your life. You have to keep up on the information. You have to know what the new tests are, know what the new medications, and some medications are being developed that are going to be more effective than previous ones. You have to know what new technologies are. So there's always research going on in efforts to prevent, control, or cure many disorders. And I would love to. I have the dream of seeing a cure for MS in our lifetime. I have seeing a cure for Parkinson's in our lifetime. So new developments and researches are so interesting and so important in the healthcare field, and we can't just lean back on what we already know. So years ago I worked in a clinic, and the owner was a physical therapist who had gone to school, 20-something or more years before, and I would often hear him instructing patients in different ideas that have really since been debunked. He didn't really keep up with the current knowledge. I didn't work there very long. Maybe that's a factor. But I didn't want to go up and contradict him. I just didn't think that would be polite. But it's important as healthcare professionals that we do keep our knowledge current and we keep up with new developments and trends.